Hi everyone, so this is the case study videos for Chapter 19, 2021, OT 63. Let me get that into focus for you. There we go. Alright, so Chapter 19, you have the odd cases. Case 1 is a physician's office note. It goes through the patient. It's a 50-year-old patient seen in office today for follow-up for renal insufficiency. There's the history of the present illness. Patient had a renal biopsy, showed focal and segmental glomerulosclerosis. I don't know why I have glomerular hyphenated there. He was placed on Vasotec and developed hyperkalemia, and then the Vasotec was stopped. So, he has all kinds of other stuff here. Let's see what else is important. Lab data. Okay, so his diagnostic impression is chronic nephritic syndrome with focal and segmental sclerosis. So that's what we're going to look up. We're going to look up sclerosis first, and then focal, and then segmental. So it will probably also give you a C also code because you're probably going to need a fourth character. So I'm going to put a little notation up here that you may need a fourth digit there, and that may have like a 0.1 or something. Just kind of be mindful of that or check, okay? So for this one, you're going to look up sclerosis. And then, what did I say? Focal, and then segmental. So that's case 1. Let me flip over to case 2. Oh, sorry, case 3, I guess. So for case 3, skilled nursing facility, progress note. 84-year-old man seen today at the request of the charge nurse. Patients experiencing urinary retention. No other complaints were noted. Just hurt. Okay, so here, so everything looks like it's been normal. So his head, eyes, ears, nose, throat were normal. Lungs were clear. Heart, no sinus rhythm, normal sinus rhythm, no murmurs. His abdomen was soft, non-tender. There were no masses. But when they did the rectal exam, they found a smooth, enlarged prostate, although no other findings were noted. So that looks like that's going to be our diagnosis. However, it did say up here that he's experiencing urinary retention, and that is often a symptom or a complication of prostate enlargement. So we're going to want to make sure we take that into consideration too. So let's code. We'll look up enlargement. Prostate. And then let's look up, see if there's a code for with something like lower urinary tract symptoms, then that's going to be your winner. And then did he say, and then I think you also, I'm going to put a little note in here that you may need, you will need, additional code. Now, for urinary retention. Now, this will be indicated by the instructions in your prostate enlargement code. Okay? So that's case 3. So let me move you down here. Ooh, there we go. To case 5. Down here at the very bottom. Miss Fenton. Pain and burning when urinating. Low back pain. Culture showing she was diagnosed with cystitis. Okay, so that's pretty easy. So you're going to look up cystitis there. So that's going to be your diagnosis there. Let me flip over to case 7 and 9. So 7 is an emergency department note. Sorry, I got wrapped up in cords there. And you have a 51-year-old male patient to the emergency department. Extreme pain. UA shows hematuria, so he's got blood in his urine. Ultrasound shows renal calculi, so he's got kidney stones blocking his kidney and ureter. Okay, so you're going to do look up calculus or calculi, and then kidney. With calculus. Cal. I didn't remember how to spell calculus for a second. Nope, that's not right. There's no O in there. So kidney with calculus. And then was there one in the ureter? Yeah, ureter too. Okay, for case 9. 46-year-old female, but IV antibiotic therapy. Experiencing chills, fever, flank pain, nausea. Scheduled ultrasound to determine if kidney is enlarged. She's been treated for acute pyelonephritis in the last 10 days. Okay, so we're going to do pyelonephritis acute. So that's going to be case 9. Alright, so that's it for chapter 19. I'm going to pause you and flip over to chapter 20. Okay, so this is chapter 20. We're doing the even cases for chapter 20. So we start with case 2, which is a discharge summary. Patient is gravida 2, para 1, seen in her office today has been seen in office for all of her prenatal visits. Prenatal course was uneventful, so no major worries or concerns there. Admitted with a history of contractions every 3 to 5 minutes. Cervix was 100% effaced and she's 9 centimeters dilated. So hospital course. Time of admission, patient received IV, was placed on fetal monitor, water broke at 2 a.m. After 3 hours, patient delivered a baby boy with APGAR scores of 8 at 1 minute and 10 at 5 minutes. Postpartum care was uneventful. Patient was discharged 2 days later. Easy peasy. Okay, so here's what you want to do. You want to do prenatal. And then there will be a C pregnancy. Oops, I just made an L with a parentheses all in one little thing there. And then, so that's 1. And then outcome of delivery. Single live born. It said she only had one baby, right? Delivery baby boy, yeah. Will be your other code. Okay, so that is, let me put that down there so you can see. So that's what you're going to look up for case 2. Alright, so case 4. Let me flip over here. Case 4. And case 6. Okay, so Linda presented to the hospital in active labor, admitted, fetal monitor was used, unstable fetal heart rate, 100 to 125, fully dilated, the baby was in breech position. She was instructed to begin pushing. At the time, fetal heart rate dropped. Turned the baby, but this attempt was unsuccessful. Emergency C-section. Delivery was successfully performed. Okay, so for Linda, we're going to look up delivery. My little microphone thing keeps falling. Delivery, cesarean, and then breech position, breech presentation. Your first code, your second code, same thing as case study 2, outcome of delivery. Single live born. Alright, so that's case 4. Case 6, 25-year-old patient being seen today for follow-up care. Gestational diabetes is controlled by diet. Pregnancy is progressing well. Vital signs are within normal limits. Fetal heartbeat was normal. Follow-up within 3 weeks. 30th week of pregnancy. So that's going to be important, that 30th week. So we're going to look up diabetes, gestational, and then you want to look up the 30 weeks gestation code. Alright, so that's case 6. Let's go to case 8 and 10. So case 8, 13 weeks, so that's going to be important. She has hyperemesis, electrolyte balance. She was given IV prenatal vitamin supplement. She was nothing by mouth. So so she's got pretty severe hyperemesis gravidarum. So that's what we're going to look up. I can't see anything else there. Emesis gravidarum. And then we want to look up the severe. If she's on IVs, that's severe. And then you want whatever the code is for 13 weeks gestation. Oh, sorry, you're out of the frame there. There you go. And 10. Okay, so this patient returns to the office today. Okay, so this lady has mastitis. And you want to select the code that is for obstetric or is associated with puerperum. Okay, so that's it for chapter 20. Let me get flipped around and I'll be right back. All right, so case 1 for chapter 21, because you have the odd cases, inpatient physician progress note, 2-day-old infant examined today, follow-up after results of a diagnostic test. Blood gas studies indicate reduced oxygen tension, ineffective gas exchange. Chest x-ray indicates the presence of infiltrates. Infant continues to exhibit signs of infant respiratory distress syndrome type 2. So that's probably going to be your diagnosis right there. So we're going to look up syndrome. And then respiratory distress. Newborn. Poor guy. And then type 2. So that's your code for case 1. For case 3, let me get flipped over here. Let me bring 3 down a little bit and then I'll push it up to 5. So for case 3 is a discharge summary. Let me read this really quick. Okay, so you're going to have a couple codes here. So you're going to have poor kid. That should be 2 words. I know it looks like it's all one, but I'm writing sloppy because I have to get out of here and go to work. Okay. Let me try to focus this. There you go. Okay. So that's for case 3. For case 5, hospital visit note. Oh, the sun just came in my window. Can you see how much brighter it got? Let me read this. Baby boys experiencing some respiratory distress. These poor babies, I don't like sick babies, you guys. Okay. Okay, so you're going to have 2 codes here also. So your first one is distress. Respiratory. Newborn. Now the second code is going to be a little bit tricky to find. And it is going to be under newborn. Okay, so the second code will be newborn affected by the maternal hypertensive disorder. All right, so case 7 and 9. Start with 7 up here. Discharge note. Jaundice, hyperbilirubinemia. Phototherapy. Discharged. Okay, so you'll have 2 codes here also. So you will have newborn, a singleton, and then newborn, hyperbilirubinemia, rubinemia. So that's for case 7. And then the last one, case 9, 4-day-old infant. Pedialyte. Okay, so again, you're going to have 2 codes. Same as above, you're going to have that Z code for the newborn, born, singleton, birth, and the hospital. So newborn, and then your second code is going to be diarrhea, neonatal, non-infectious. Okay, so I think that's it for 19, 20, 21. If you guys have questions, we will try to work through them together in class on Thursday. All right, thanks guys.